Everyone, I'm Ed Stern, a board member of OutCare Health and a psychiatric nurse practitioner with Queer Ear Mental Health in Washington, D.C. I use the pronouns he, him, his. Thank you for joining us for the OutCare Health Talk series. It's a webinar series devoted to discussing diversity and intersectionality in the LGBTQ community. We have many people joining us from across the country today, and I really want this to be a safe and welcoming space for everyone. So please feel comfortable asking any question today. All of our Out Talks are recorded and can be watched on our website, outcarehealth.org/outtalk. I'm really excited for this Out Talk today. The topic is missing from medical education, an LGBTQ plus curricula. It's a topic very dear to my heart as an educator. Today, we are hearing from inspiring people doing amazing work across the country, and I am very thankful for our moderator and my friend John. Keep in mind that today is being streamed live. So John, take it away.
Thank you, Ed. It's always delightful to see you. Welcome, everybody. It's so great to have you on board today. And as Ed was saying, this is an open conversation. We have some amazing guests from all over the country who have their own beautiful, powerful experiences and expertise in our conversation today, really about the education system and the medical community and LGBTQ well-being and health. Once again, it is a space where questions are welcome. If you want to go into the chat or into the Q&A, you can drop them there. We'll try and monitor them as closely as we can. And if you have a chance, just introduce yourself in the chat, say who you are, if you're with an organization, and what part of the country you're in. Just a good way for all of us to join together. With that said, I want to invite our guests to introduce themselves, and they're going to tell a little about who they are, what they do, and a bonus question that they get, and they're just hearing it now: cake or pie, and what flavor? So with that said, Allison, why don't we start with you today?
Well, good evening, everyone. I'm Allison Pittman. I'm a clinical assistant professor in nursing at Texas A&M University in College Station, Texas. And I have several research interests, but improving the healthcare of LGBTQ folks, especially youth, because I'm a pediatric nurse, is a huge research interest of mine. I have been a nurse for 25 years, and I was really excited to be invited because I love the interprofessional perspective and having different health professions chime in on this topic. So I really appreciate being invited. I am definitely cake or pie. I'm definitely a cake person. I love both, but it would have to be chocolate cake with cream cheese frosting. That's my heart.
And look at your face light up with that.
Yeah. Oh, it's like romance.
I think someone's having a piece of cake after we finish tonight. I love it. So Craig, say hello and who you are and the work that you're doing these days.
Sure. Hello, everybody. My name is Craig Johnson. I am the group manager for the American Medical Association's Minority Affairs section. So it's a constituency group comprised of Native American, Latino, and Black physicians and medical students, as well as other underrepresented groups. And the largest focus of our work is policy that ends up going before the full House of Delegates in the House of Medicine. I also am a trustee of my alma mater, which is Antioch College in Yellow Springs, Ohio. I'm also a former board chair with the AIDS Foundation Chicago. So I am a former resident of Chicago, where I was born and raised, and I now live on the West Coast. And most recently, I was added to the board of GLAMA. And so that's a very exciting volunteer work. And I'm just delighted to be here to talk about the issues and LGBTQ health and medical education. And really, as always, it's always about how do we improve patient outcomes. So in terms of cake and pie, That's really a challenging question. I like both a lot, but I'm going to go with key lime pie.
Ooh, nice. That's actually my husband's favorite dessert of all
Okay.
time. He's a key lime pie person. And it's got to be very puckery. So thank you so much. And Faye, it's lovely to see you. Tell us a little about your work and your life.
Hello, so my name is Faye. My pronouns are they, them, theirs. Thank you for having me here. So I am let's see, where am I? I'm coming from Lancaster, Pennsylvania right now. I am a 6th year MD PhD student at Penn State College of Medicine in Hershey. I just submitted, exciting as I just submitted a paper that I'm hoping is going to push my way through the end of the PhD and back into medical school, which I'm very excited to get back to medical school in the next year. And I am also the current executive director of the Medical Student Pride Alliance. And we are an organization much like LMSA and ANAMS and APAMSA, some of the other organizations that have a little more history. But we are an organization committed to supporting the success and the current and future of current and future LGBTQ plus medical students through their education and their careers by fostering community and connecting members. So I'm really excited. I've been a part of MSPA for about a little over 5 years, almost as long as I've been in medical school. OutCare was one of our first partners that we made when I was on the external affairs team, and we've since had many members there. So I'm excited to be representing MSPA here as well. And if you're lucky, my cat Blossom is asking for attention, so she might come up and say hello. As far as cake or pie, I have to admit, you know, as a queer non-binary person, it is hard for me to make decisions, but I will choose cake, and anything with chocolate is a win for me.
Nice. Thank you so much. And once again, my name is John Sovak, and I am a therapist here in Pasadena, California. And I specialize in working with LGBTQIA+ adolescents and their families during the coming out process. I'm also the author of Out, A Parent's Guide to Supporting Your LGBTQIA+ Kid Through Coming Out and Beyond. It just came out in April, and something that I'm really incredibly proud of. I was really fascinated by this topic, especially coming up today. And the one thing that I thought we might want to start at is actually if each of you would share a little bit about your educational experience. And did your program provide any awareness of the needs of the LGBTQIA+ community and how you saw that as you took your journey through your own education? So I'm going to come back to you, Allison, again, just because you got the nod going. So I see some thoughts there.
Well, I went to nursing school in the mid-90s, and we had nothing on LGBTQ health, nothing. I lived in Austin at the time. I went to University of Texas in Austin, and you know, most of you probably already know this, but for the last, 50 years, Austin has really been a haven for the unhoused. And we had a lot of work in our education where we worked with the unhoused, and a lot of them were youth, especially. I'm sure we all know that like a quarter to a third of LGBTQ youth are unhoused at some point. They get kicked out of their homes, they don't have a place to live, and so many health risks with that. And so that was my first encounter. It was, in clinical hours for my school, but it wasn't, there was no classroom time devoted, but we just learned by working with our community. And I absolutely nothing. And as I worked through that, and also working at 2 children's medical centers where we had many patients who had a lot of the health disparities and the risks that we talk about, that injustice sort of inspired my work. So like many of us of a certain age, I just sought out my own training. I went to the LGBTQ health certificate program at the University of Louisville, which is wonderful. I'm sure many of you have seen that program. It's been around for a while, and that just spurred me to just do even more in my continuing education and research. So to answer your question, we didn't get anything classroom wise, but what I saw in my work is what made me want to seek more education.
Faye, because you're currently in program, what's your experience?
Yeah, I think it's being currently in the program. I've actually been able to be here for 6 years and see a lot of growth in a program that didn't have much LGBTQ plus education when I started. So I think that's been really inspiring. When we started, I think it was a lot of, we're really only seeing queer people show up when we talk about HIV, which is what you see so often. It's in a very stigmatizing way. And I think that they did a good job even then of attempting to remove the stigma, although it wasn't, it was not perfect. But over the past few years, we were really lucky where I am to have a number of students and faculty members and some folks from the humanities department as well come in and kind of form a task force to retool the curriculum entirely and try to bring LGBTQ health concepts, not just as like, and today we're going to talk about queer health, but really trying to find places in every course to infuse it. So we're talking about, using gender inclusive language in anatomy and bringing in more diverse patients into our problem sets on a day-to-day that don't just have to be stigmatized. So I think we've been fortunate to see a lot of growth. Being a part of the Med Student Pride Alliance, I also get emails frequently from folks who are on either end of that spectrum where they're like, hey, we're doing really good and we have a lot of resources and we want to share that with other schools. And we also get emails and messages from folks who are saying, hey, how do we get started? Our school's not doing great. So I know that where my schools is right in the middle right now, as far as medical schools.
Mm-hmm. Yeah, and Craig?
So I am not a physician nor a medical student, but I certainly work with many each day. And, so I can say from my own experience, certainly not in my undergraduate experience, but, to speak to the experiences that I'm aware of many of our members, LGBTQ health on average, I believe, gets, roughly about 5 hours out of the full curriculum in terms of undergraduate medical education. And, we know that, certainly there are programs that go higher than that in terms of offerings. But, I think that there's so much more to go. I also believe that, what happens is we need leaders on these student campuses, whether they are students, whether they are staff, whether they are faculty, but allies who absolutely appreciate the need for more LGBTQ health education for medical students so that by the time they go into graduate medical education or otherwise, residency and fellowship, they're not standing for their first time, for example, in front of patients who identify anywhere across the LGBTQ spectrum for the first time and just not just not exactly knowing or otherwise feeling comfortable about kind of how to lead that patient interaction, how to begin to think about screenings and appreciate, certainly the diversity that exists across the LGBTQ community. So no doubt that there's a need for more. I think, I literally had this conversation with someone recently, and the question, is when do we squeeze that in, right? This was a medical school administrator. And when you know that, medical students are in their programs for 4 years on average, that's not including if you're a joint MD or a joint MPH or a joint PhD where you're in much longer. But, you know, the question then becomes, do you add a 5th year, right? Or do you add a pre-program before classes really get underway as an M1 to almost jumpstart conversations? So before you even can talk about parts of the body, right, and how to fix them, let's talk about humans and patients and understanding the intersectional relationships that exist there. So I'll just kind of
It's interesting you say that connection to the human side of it, because I was doing a training a few years ago with a hospital out here in California. And about 2/3 of the way through the training, this person talked to me during a break. They're like, oh, so we're learning about this LGBTQI stuff because this is like just cultural competency. It's like, yes, thank you. You get to go to the head of the class. It is another piece of cultural competency that I think is vital into this education system for providers on all levels. I mean, I know in my particular program, I would say in the course of it, maybe 3 hours at most of very generalized LGBTQ stereotypes and caricatures rather than actual like specific things that might be of value into the community and looking how that might play out in different aspects of the community. And that it became, like Allison said, almost a piecemeal thing where I may be an openly queer man, but I can't use my lived experience to be the only way that I work with my community. And so I know for myself, I did the same thing, Allison. I took a piecemeal approach and found the trainings and the places where I could get those answers. And it's interesting because for me, that piecemeal approach is another thing that we've talked about quite a lot here on this program, is that a lot of people seeking help also have to do a piecemeal approach to find the people that can provide for them. And do you see this as definitely a repercussion of this lack of education? And how do you think it's actually affecting client care?
So I just want to be sure the question is kind of
like, how do you believe these gaps in the education of providers is actually affecting client care? The people are coming in to these places and wanting their basic needs taken care of, and there are these gaps in education.
I can go first. I think it affects client care in 2 ways. You know, one is very much the cultural competency, as you were discussing. You know, I give a seminar, and one of the first things that we ask folks when they come in and then when they leave again is, you know, how comfortable do you feel talking about these topics, related to queer health care? And when people come in, they don't feel comfortable. They don't feel comfortable even saying the word queer sometimes. And it's something that in the community, I think we're more normalized to, and you expect your physician to be able to say, you know, words related to queer health care the same way they should be able to say anatomical words. So I think that's where, you know, we also know we have plenty of evidence showing that a lot of trans folks in particular see discrimination in healthcare, and that's where that comes from, is when you're not seeing people who can accurately converse with you. I think the other part of it is in the content itself, right? If we're the number of physicians, primary care physicians who I've met who feel perfectly comfortable prescribing hormone replacement therapy to cisgender folks for acne or for you know, what would be considered cisgender beauty standards, they're perfectly comfortable doing, but very uncomfortable doing so for trans folks or folks who are not familiar with, you know, safe use of PrEP. I've met physicians who didn't know that PrEP could be used by women as well as men. And so some of it is just it's both on the medical side and it's on the cultural competency side.
Mm-hmm.
I would agree with Faye. We did some surveying of our health science center, which is 5 different professions, the students. And the number one thing that our students say is that fear of not knowing what to say or saying the wrong words or offending someone. And just that just like Michael says in the chat, that cultural humility and cultural competency, especially in communication, those basics we're not really getting. I also think we're seeing that providers are not aware of the risks and the screenings that might be needed, especially related to mental health, when there's a lot of intersectionality and an individual has a lot of different things that make them at risk for things like depression, anxiety, things like that. You know, and being in the state of Texas, I think there's lots of other factors that affect what we witness, and the political culture and the laws that have been passed in the last few years are certainly something that you can't ignore in my area of care, for sure.
I would absolutely echo everything that's been said, and you know, to take it even a step further, you know, I think that when there are gaps in education, then there's and gaps for appreciation of everyone in your patient community, then there are gaps in trust. The patients don't necessarily trust physicians who are there really to help them live their best life, so to speak. And you know, if they don't trust the physician, then they won't arrive ready to engage in what is clearly, you know, really one of the most meaningful partnerships you're going to have in your life is with, you know, a physician about your own health. And so you're depending on that person to be competent and confident based on, you know, a really robust education, hopefully one that included LGBTQ health, one that makes them aware of various disparities that may impact them as patients. We know that, you know, a lot of times physicians encourage patients to self-educate. I think that's certainly important. But when it comes to being the expert in the field and knowing how to navigate all of the myriad of things in health and well-being, you want to be able to have a trusted relationship. I think when you look at so many populations, there is a lot of mistrust, certainly in communities of color. And you know, that I know is a whole other webinar, but I also believe that simply understanding that for myself as a Black gay man, I need to know that my physician, my primary care physician, and any other experts that I'm seeing really understand that notion of trust, that while I happen to work in healthcare, the overwhelming majority of people that I know do not. And so they're not coming at it from the same perspective that I am. They're a lot greener, or in some cases, you might say more vanilla. And so when they're coming in, they're really looking for guidance. They're looking for, you know, walking into any physician's office is often a cause for anxiety and stress. And, you know, if the forms were not gender inclusive, if the staff was not warm and inviting, and the physicians lead that, you know, essentially how an office is administered, because they do set that tone, right, for a welcoming environment for all their patients, or at least we hope that they do. And so I think that when there's that gap in education, I think that when we have to depend on those physicians to actually seek that extra enhanced education. And we know that there's different places to get it when you're not getting into medical school. I can think of several. I know certainly and in fact, I'm actually very proud to have worked with some of our members to develop a curriculum around LGBTQ health that, you know, talks about everything. I've got a little cheat sheet, but the spectrum of sexual orientation and gender identity, gender affirming care, developing inclusive and welcoming clinical environments. It's a body that comprises about 21 and a half CME credits. So John, as you were saying about people skipping around, so you can get some stuff there, you can get some really good content there. We've actually partnered with Fenway and with Whitman Walker on some of that content. They too are other places that are go-to. We know OutCare certainly has some amazing resources. We know GLAMA, right? So we're naming all of the, I'm naming these kind of well-known spots, but should you have to go to these few, knowing that there's an abundance of need for a lot more and readily available information. And so if we're going back to patient outcomes and how we can best improve them, I like to think that medical education is a place to start that and to arm up our healthcare workforce so that they're really ready to walk in and start the day. Imagine if your first 3 patients on your first week, every day you walk in, they're all among the LGBTQ population, and you weren't prepared for that. So suddenly you've got to study up really quickly. And, when I think about whether it's my own burdens, whether I think of the burdens of people in my community, if you're going in, it may not be for a happy, just annual checkup. And so, again, that goes to the cultural competence. It goes to just really the need to arm up our healthcare workforce. And I hope that at some point in the near future, it's no longer kind of a hide and seek where you're trying to find the resources, but that those resources are so readily available that, imagine if LGBTQ health was offered as a full course, if you will, that got due time in undergraduate medical education. I think that would be amazing.
Mm-hmm. And to really talk about the challenges for patients coming into care, Lindsay shared a comment that I think is just so powerful. As a wife of a transgender woman and mother of a transgender child, in every encounter in medical settings, we are the expert in the room and not the medical staff. It creates a huge gap in trust, and having to rely on medical staff as the gatekeepers to care when they know next to nothing can be infuriating most every time. And this is a story that I hear over and over and over with the people that I work with. And we also know for a fact that two of the barriers to accessing healthcare for the LGBTQ community are trying to find competent providers and having a negative previous experience. And that makes it really hard for a lot of people to actually try and access care. And I think that's why this conversation is so important today. And especially to know that there are organizations like OutCare Health that are providing these curriculums. They have an in-depth on-demand library. There are places for it all to be found. And I want to really encourage our listeners who are not part of the LGBTQIA+ community, is you've heard from some of us that I went through my program, it wasn't there. I'm an openly queer man. I searched out. Allison talked about going through her program, realizing it was there, searching out the information. I hear a lot of people in the queer community searching out for the information, but I want to express that it's important for our cisgender, heterosexual compatriots and allies to also seek out this education to make it an incredible part of their program, because that's going to make you as a caregiver so much more well-rounded. And it's going to be, you can become a powerful ally into your community. So let me get off my soapbox. But looking at that, I mean, if you were going to create a curriculum, where do you think some of the most powerful steps could begin in these programs to open up the doorways for more affirming LGBTQ care? What are some of the specific things that you might like to see coming right into programs like next semester?
I would love to see an interprofessional approach. I mean, I know not everyone goes to a school that hasn't, is a health science center or anything like that, but those who have them, for example, here we have medicine, pharmacy, nursing, public health, and dentistry. And that first session, especially the one that is the sort of primer on culturally competent communication could be interprofessional. And the other thing that I think would be really important is to include simulation. I think simulation is a huge part of helping students to understand, to have a safe place to practice what they want to say and how they're going to treat people. And that was my favorite part of the training that I've gone through. And I, even here at A&M, we had a MedPride organization do a very simple simulation here where they had a waiting room that was pretty much your standard waiting room that you see at most doctor's offices. And then they had another waiting room that was LGBTQ friendly. It had a statement on the wall about welcoming all sexual orientations and genders, and there were magazines in the magazine rack, and all of these things that made it more welcoming. And we had students walk through both of them and notice the difference in how welcoming it was. Things like that are really meaningful to students, and being able to have a safe place to practice communicating and being competent is a really important part.
And Faye, you had mentioned that in your program, like making an effort to have more of the simulated patient interactions be with people of the LGBTQIA plus community. Did I hear that correctly?
I have said that at previous talks. I don't know if I said it today, but
You
it was
must have.
definitely on my mind. I really love the interactive piece. I think that it is really important to have actual queer folks doing the simulation, because if you haven't lived a queer experience, it's hard to know how to ask and respond and live that. And I'm thinking of an off-topic thing now of like non-queer people playing queer folks on TV, which we're likely seeing less of. But I think that having that is a really great thing. And I know that it's not necessarily something that can happen next semester because of how hard it is to put together those programs. But it's so important if you're someone who's working on curriculums long-term and can build that out. I think really, really helpful things that take that you could do this semester that don't take as much buy-in and finances is adding a session on historical harms, right? Like give your students some histories. Why do we have to care about this? Why is it important to learn about this? And it comes back to what both Craig and Allison and you, John, were talking about in terms of healthcare discrimination and fear and those experiences, those negative healthcare experiences. We want, in order to get a person to be comfortable with you, you have to understand why they might not be comfortable with you.
Mm-hmm.
I'd love to see, in addition to what's been said, right? We're going to squeeze a lot into that first session, but really like an LGBTQ 101 that really serves as an introduction. I think Faye said it so nicely. If you don't come to this from a lived experience, you just don't know. And how can we help people understand what that means and actually help manage expectations? I would love to see an intersectional approach to LGBTQ health at the very beginning. So how do you, as you're learning this, right? How does this impact also your patients that you are seeing, along the lines of gender, along the lines of race and ethnicity, along the lines of age, along the lines of social determinants, and how are the health outcomes just even in your own neighborhood, right? Because we know in cities that can change depending on what side of town you live on, what your zip code is. And so I'd love to just have people truly understand what's at stake for their patients and for their practice, because their practice we're always talking about measurability. If you are improving the health of your patients, you're being successful. You are in tune with who they are and where they're coming from. And you're offering more in terms of support. You're offering guidance in terms of how to, again, live your best life, and doing so in a very healthy way. And I think that there's something to be said about the intersectional approach that often does not happen. It's almost as if, I think it helps people to understand why it's important to start to look into those overlaps. So that, if your primary audience is women, your OBGYN, you do need to understand that your patient base is probably gender diverse. And there are going to be some issues there that may not be standard, that weren't taught in med school, right? And so how do we help them through this new course, this orientation to LGBTQ health, get them to understand a lot of the nuances, and then how it's applicable across other areas of practice and other specialties.
Mhm. Allison, did you want to add to that? I feel like you had some thoughts, maybe.
Well, I completely agree. I was just sitting here thinking about what we keep coming back to is that all of the providers who maybe didn't go to school within the last 10 years and want to come back, that's another part of this. What we want to see is lots of opportunities and some, I saw somebody write in chat, and it's gone way up the thing, but how do we get people to come back and get that continuing education that didn't get it? And I think, awareness combats the fear that I think some people, the fear of not knowing what to say, not knowing how to care for patients, that more awareness can help with that. So I think that's an important part of what we're talking about is, and what Craig said was right. The last resource that I could find says an average of about 4 to 5 hours in medical school, and they're the best of the bunch. Nursing, pharmacy, public health's really good, I should say, but dentistry, all the other health professions are behind. And so, think of all those providers out there who didn't get that at least 4 hours, and who have patients that could really benefit from that care.
Oh, Faye, I think your mic's off. It was the cat.
It was the cat. I apologize. I love that 4 to 5 hour study because it comes up every day, right? Like we're all familiar with it, and we've been talking about it for so many years. Someone here, we need to be reproducing this and seeing, because this data is now 11 years old, right? And I really want to see what it does look like now. And I think it's interesting because we're talking about like bringing the people back as well to talk about like learning this anew. But I do want to share that a lot of folks in med school still aren't learning this now. I remember having in my first year of med school, we had a speaker come in, and we were very fortunate to have a speaker come in. And they talked exactly about what Craig was talking about. They were talking about like, what is it like to be a queer, Black, non-binary person living in central Pennsylvania? And they were throwing around all these words and definition and terms. And at the end of the lecture, there was like an odd circle of folks around me asking, what do all these words mean? Like, I have never heard these words before. And so that 101, those definitions, the basics, like so many people still do not understand the terminology.
It's interesting you say that, because I travel the country speaking at any place that will bring me up and give me a microphone and a slide deck. And oftentimes people see 101 as a one and done situation. Look, we did it. We're competent now. We're done with this whole story. And what I do find is that people are actually hungry for more information about the care in our community. It is being requested and required. The thing that's really fascinating is we go into beyond the 101 presentations. Often the people attending that never attended a 101, and you find yourself backtracking to provide definitions.
Yeah.
And so I think it's this thing where we're chasing our tail right now, and we need to find ways to catch up and get that competency to become holistic. I'm curious too, if any of you are aware, I know of like 3 or 4 psychology programs that actually have an LGBTQI specific specialization and track. Are you aware of any programs out there that do have that already in their design?
I know that University of Washington does. I just happened to be on their page recently, so that's why I know that. I would imagine that there's a couple others. I believe Rush University Medical Center in Chicago, and they also have a brand new trans care center. It's almost that it's the same, that the question that you're asking also speaks to, can we name 10 right off the top of our heads? I struggle personally to name 10 programs. I know that they exist, and I'm aware of our physician colleagues who are working through these and trying to develop them and introduce them into the curriculum of their various institutions. I will share, and PEN is another one. I'll drop the links in the chat if I can before the end of our session, but I think it's a hard struggle to actually find out where those are. I'd love to see that be almost warehoused, if you will, on a single site, whether, that's something I may even take back to our colleagues at the AMA, or even share with our colleagues at AAMC, the Association of American Medical Colleges, because I know that they too have a pretty significant health equity and diversity team. And this would be something that would be of interest to them.
I've seen a lot of programs boast their gender health clinics, all opening within the past, with a number of new ones opening across the country in the past few years. But I similarly, I could not name the programs that have LGBTQ plus specific tracks.
I agree. Lots of postgraduate certificate programs. I know, and of course I'm nursing, but there's Columbia has a certificate while you're going through school that's for transgender and gender but non-binary care, which is great. And then Callan Lord, which is in New York, has it sounds so cool, the Keith Haring Nurse Practitioner Graduate Program, which is in LGBTQ health. Those are the only 2 that I know of that are very, not just an elective, and that's actual, significant training.
And what do the 3 of you imagine are the challenges or even the resistance that is existing currently for these types of programs to be developed, or even bring in some of the more cultural competent components that we're discussing here today? What do you think the resistance is in these programs, or the challenges they're facing in trying to open this up?
A couple of those that come to mind for me would be time, would be the constant question that's always asked: what's the value add for our students? I would say the academic approvals process, which if anyone's ever worked at in the administration of a university or college, just to change a light bulb may take several committees and a lot of time to review and consider. And once you've gone through that, there's no guarantee that you actually come out on the end with what you feel is best for the students. But and then of course, financial resources to pay for the content, whether you're paying for faculty members to teach it, to bring someone new on. Are you adding to existing faculty's burden by asking them to take this on? So I would imagine those are going to be some of the barriers. And I think the other is going to be the political landscape, right? What are the politics on the campus of the school that we're talking about? Because, just as Allison said, we know it might be a little bit different sometimes in Texas than it might be in California. It might be a little bit different in Florida versus New York. So those, and again, then we're talking literally the political determinants of health. So we're not just talking about state and federal legislation, we're literally talking about campus politics. And if it's not coming from the top down, it's probably not going to get the support that it really needs to be effective.
I have to agree and say, if you don't live in Texas, there are lots of other states that are having a lot of the same political culture and laws being passed. But, we, in the last 2 years, we have had laws passed that, ban puberty blockers, ban gender affirming care. Trans athletes can't play on teams that are their gender identity. Drag shows are now being classified as sexual misconduct and are, they can be interpreted as illegal under some new laws. And so there's also a lot in the landscape of academia that I think makes it difficult. A lot of states, including Texas, are saying diversity, equity, inclusion is banned. For employees, you can't hire based on it. You can't spend money or time on it. And so all of that, I'll be honest, in the last couple of years, those of us who work in this arena, it's like a heavy weight on your chest, and so that is a big barrier for funding, for research, in a culture like that. It's difficult.
I really, really strongly agree. I think the top two things are both the combination of local and institutional politics and finance. And I think that, we've talked a little bit about state politics. It's also local within state. A lot of the programs that were mentioned that exist, they are at large institutions with large endowments in big cities. You're not seeing many programs in rural towns, even in maybe like politically liberal states. I think one of the other things with funding is sometimes schools can be really well funded, but the funding comes from restrictive sources. And I know we've seen that at Penn State, where there's a number of limitations on how funding can be spent based on where our initial endowment was from.
The one word that comes to my mind with all of these comments you're making is momentum. The medical institutions, all levels of what we represent today, have been moving along at a very definite pace and direction for a long time. And so our voice is asking for us to just take a little bit of a turn in the road. It's a big momentum we're pushing against. And I think it's interesting because, Greg, you were talking about like the top-down version, and Faye, just from the work you've talked about that you're doing, like you all are working from the grassroots upside. And I think somewhere in that momentum, it's about bringing those pieces together. What are students going to demand going into programs? And then how can the administration now find ways to meet those needs? And I think we're in a time where some of that's happening, although recently I feel there definitely been backsliding and all of that,
Yeah.
We absolutely need both. My recommendation to students when they ask, like, how do I get involved, is always to find an ally in a faculty member with power, because they have the power, but they often can't talk about it because of the politics. But as students, you actually have a lot of flexibility to be loud and to make noise and raise some trouble without having to watch your back quite so much. And so the faculty member you can pair with and make sure that they introduce you so that you're being loud in the right ears.
Well, and Faye, I can relate to that immensely because in my program, I was that voice.
Mhm.
Administration wasn't always happy with me,
Yeah.
but I would ask the question. I was like, why? Why
But
don't
what
we?
if,
How can we
just
make
a
this
little
happen?
naivete.
Yeah. Yeah.
Um, I also really want to raise a point in the chat about all these bills that are creating, causing harm for trans folks and also causing harm for our intersex siblings with these very specific carve outs for them. So I think I think intersex folks often get lost in the conversation here, and they're not talked about enough. And there's a lot of space for intersex advocacy and intersex healthcare to be added to our curriculum. So many med school curriculums they're not even behind, they're backwards on how we talk about our intersex friends. And it just needs to, we need to be louder.
Mhm.
We need to talk about it more.
Faye, that is, I completely agree. In the surveys I talked about that we did with our students, the one when we asked them about were they comfortable or do they feel like they could competently provide care to different communities, I kind of thought that transgender would be the ones that were the least comfortable with, but it was actually intersex, and a lot of them they wrote out a comment that they didn't even know what that word meant.
Mhm.
And so but that was even higher than transgender patients. Intersex patients were the ones that they were least familiar with how to provide competent care for.
Yeah. There's a lot of harm to the intersex intersex community and intersex kids every day. I definitely encourage folks to check out interact.org. They're a really wonderful community organization.
Mhm. Yeah. So
Yeah.
we're getting close to time, and we have a closing question that we ask on every panel. And it really is taking into consideration the conversations we've had today, the experiences you've had through the course of your own education and the work that you've done. What is your hope or vision for the future?
I'm just going to jump in. My hope is that that everything that we're talking about today is not a hope, but it actually is in place, that it is strong, that it is it's literally a matter of fact, that we're not talking about why it's important, how do we implement it, how do we tie it to accreditation. I think my hope for the future is that all of this is solved, that folks are confident in their healthcare workforce, that the healthcare workforce is doing everything possible that they can for all patients, and that absolutely and equitably to include the full diverse spectrum of the LGBTQ community. I think that's really what I would like to see.
I would like for, Craig has talked about how the AMA has come out with statements, and they're not new. They've been around for a long time, that we need to provide more culturally competent care to LGBTQ folks. The American Nursing Association, the National League of Nursing, all of our accrediting bodies and professional leadership organizations say we need to do this. And there's this huge gap that we're not doing it. And, my hope is that everyone gets at least that 101. I mean, that's the first step. We're not even giving the 101, and to really make that a priority to be in the curriculum. I would also like to see other professions catch up to medicine as the leader in providing that. And, again, some opportunity for those who are already out in the community all over the country, not just in a few places, to get that continuing education to be able to provide more culturally competent care.
Yeah, I don't think I can do more than summarize the two of those statements. I think my dream here is that LGBT, like queer, trans, and intersex folks and families can go to the doctor.
Yes. Oh, gosh. Yeah.
Wherever they are, they can go and they can feel safe and know that they're getting competent care.
That's the goal. That is the ultimate goal. Yeah.
Yeah, that right there just brings it right down to the nugget. So I want to thank you all so much for being part of our conversation today. And I think it's powerful for anyone listening to understand that the people who are sharing on this panel today are people who are standing up and speaking out and trying to make change. And hopefully what they've shared today will encourage you to bring that to your own programs as well. Looking ahead, some things that are really cool. Everyone's been talking about LGBTQ health education and training today. At Outcare Health, we do offer that. We even have a program that offers CEUs. We've got an on-demand library for med students and residents that can access this curriculum. You can find out about that at outcarehealth.org/training. Also, Outcare Health has these amazing community building and support groups that take place every month. They're safe, inclusive spaces for LGBTQIA+ folks and allies to come together, and they're free and they're beautiful and wonderful. And next week's sessions are for trans and non-binary communities and Black LGBTQ+ communities. You can sign up for them, find more out about that at outcarehealth.org/outreach. And next month, we're going to continue our series on LGBTQ care in communities of color. This is our third session on this, and we're going to be looking at AAPI communities next month, October 19th, 3 o'clock West Coast, 6 o'clock East Coast time. And of course, all of the episodes, including today's, are recorded and available on outcarehealth.org. I, from the bottom of my heart, want to thank you so much. It's such an honor to sit with each of you and experience your wisdom and your experience and the journeys you've taken. And keep doing the good work out there because you are all making a difference. Thank you all so much, and we'll see you next month.
Thank you.
Thanks so much.